Hello and welcome to my channel Medicine with Dr. Moran. Are a lot of the health videos online irrelevant? We've all seen the titles, what your skin tells you about your liver, or fix this or that just by doing one thing. Or what about if you just change your diet, all of your health problems are going to go away. Presenters say go vegan, go paleo, go keto, that's all you need to do. I'm going to show you how to try to separate the good advice from the bad. Don't just assume what you're reading or watching is actually true. Try to see if you can get corroborating information from good sources. The vast majority of videos about medical problems aren't actually made by people in healthcare, let alone by doctors that specialize in the information that's being presented. Most actually are presented by people who've never looked after patients with that specific problem. They do their research and they present their findings to you. Remember, if someone must do research, it's likely because they don't know the basics of the topic and they have no clinical experience with it. There is no substitute for clinical experience. When I research a topic for a presentation to other physicians, I'm not learning about the topic per se. I'm looking to critically appraise the latest and relevant medical studies about the topic in particular. Sometimes presenters will tell you about a small study, but they probably won't notice any methodological flaws and limitations in the study. Even if it's a good study or if it's the only study on a topic, a very small sample size of patients limit accurate conclusions. Many videos on my channel have shown examples of poor medical research. In medicine, we like to see more than just one small study. In other words, we want the study to be replicated so that multiple small studies are actually powerful enough to draw a proper conclusion. Obviously, a large study with many patients will have the power to provide a definitive conclusion. The intervention might be something that's needed long-term, and if so, what are the risks, and do the benefits actually outweigh the risks? In medicine, there's something called medical reversal. This is an important concept that's not spoken enough in medical circles, let alone in the public sphere. This is where initial research suggests that an intervention, which might be a medication or other treatment, has shown to be helpful, and it gets incorporated into standard medical practice. But with additional research, it's actually later found out to be unhelpful. In other words, it was a waste of time. It's difficult to know how often this occurs, and many researchers have tried to come up with a reasonable answer. It's likely on the order of 10 to 30%. Now, in medicine, we must be very careful about jumping on the bandwagon of a new intervention based on a small study that's not clearly powered to show definitive benefit. You have to remember in medical research that when high-quality randomized blinded studies are done, we accept that the intervention shows benefit if there's a 5% or less odds of it occurring by chance. That means if you do 100 reasonable quality studies with a completely useless intervention, 5 of them will show benefit even though the intervention is not helpful. Sadly, sometimes when the main outcomes of a study is actually negative, meaning that the intervention was not helpful, researchers will sometimes investigate the subgroups of patients in their study to see if a specific subgroup where their intervention perhaps shows benefit. If you have enough subgroups, obviously, you will find one where there's benefit, but of course that was not the predetermined metric to look at when they first started to study. You also have to remember that many negative research studies are never published, and so only the positive ones are actually seen, which can give you an unbalanced view of an intervention. Because many presenters on the internet are not doctors, they've never seen patients, and they're not able to put things into perspective. In other words, they've got no clinical experience. Anyone can find a list of causes for different symptoms or physical examination findings or drug side effects on many websites, but this doesn't actually tell you what's common and what's not common. Videos which show skin findings of certain diseases, for example diabetes, may present accurate information, but can be misleading to suggest that you can make diagnoses of diabetes just by looking at someone's skin. Now I can tell you, for example, that's not how we make a diagnosis of diabetes. The overwhelming majority of adults who are diagnosed with diabetes have no skin findings or symptoms, but have their diabetes diagnosed by blood work assessing the glucose level. Sometimes patients will bring up a concern that they might have a certain disease that they've read about on the internet, which I know is an extremely rare cause of their symptoms from my clinical experience. It's important to know what their concerns are when you see people, even if their concerns are not actually what is wrong with them. Now, there's no substitute for medical experience to put things in perspective. Knowing what's common and what's not common is very important. And sorting out serious diagnoses from less serious ones is what we do in medicine. This is why medicine is one of the few professions where being older and experienced is actually an asset. Also, you should remember when a physician presents information on the internet, we're actually accountable for it. We just can't say anything or propagate incorrect information. We have skin in the game, so to speak, as compared to people who are not physicians. Doctors have licenses in order to practice medicine, and these can be revoked for spreading incorrect information. I tell people in the videos on my channel is that when they do have symptoms, please go and see your doctor. This is missing from a lot of the health advice you see on the internet. If you have symptoms, please don't go on the internet or YouTube and try to find treatments proposed by non-physicians without proper physician evaluation. I've seen too many people with symptoms who've not come to medical attention, who've tried various things at home based on what they found on the internet. And of course, this can delay a serious diagnosis such as cancer, and you just don't want to do that. You at least want your doctor to rule out potentially serious diagnoses first. We've seen many delayed diagnoses in this pandemic due to the lockdowns and reduced availability of diagnostic testing and operating room time. I've spoken about those on my channel before. YouTube videos, of course, need to have interesting titles and thumbnails to get clicked on and shared, so it leads people to make videos on topics that can be shocking, but are not real life. It's a lot like TV shows about doctors that completely sensationalize medicine. The videos that are clicked on the most are intriguing or have a sense of threat or impending doom, so it encourages topics like, if you're doing X, Y, or Z, stop immediately. So most videos that are made are supposed to grab your attention even though the content may not be useful. Other videos aren't shown as much and don't pick up momentum. I've certainly noticed this on my channel. It's still worth it to make videos about niche topics because people do search for that, and I can refer my patients to them for additional information. Some of the first videos I actually made on my channel were about how to prep for a colonoscopy with 4 different colon preps that I use. With nearly 30 years of experience with patients undergoing colonoscopy, I know all the tips and tricks. You won't find better content. It doesn't get more niche than that. Content that should be of concern are when a presenter repeatedly tells you in a video or over many videos that this single diet or another intervention will fix many problems. In medicine, we just don't have one drug that solves many medical illnesses. Diet clearly needs to be individualized from person to person, and remember that one diet does not suit all people. The bottom line is that we all know what a good lifestyle should be, including regular physical exercise, good sleeping habits, proper nutrition, and avoidance of the bad habits like smoking, too much alcohol, and so on. Putting this into practice is difficult for many people, but this is what is needed for good health. That's why many people make New Year's resolutions every year about trying to improve their health. I encourage my patients to do that. We all want simple and easy fixes for our health, but videos such as eat this food or just drink that with an offer of curing or fixing a problem is completely an exaggeration, and it's not evidence-based medicine. Please keep these comments in mind as you surf the web. There is good content out there, and remember, your health is important. Thanks a lot for joining me today on Medicine with Dr. Moran. I'm Dr. Keith Moran, and remember, get healthy and stay healthy.